There are lots of exercises to strengthen and to address the pelvic floor, and that's why it is so important to go to a practitioner and even to the Pilates studio and to your other orthopedic therapist so you have a whole picture of what's going on with you.
We have a special guest today. This is Heather. She earned her doctorate degree in physical therapy from University of Michigan. She specializes in outpatient orthopedic and pelvic floor therapy, providing care for individuals of all genders.
So to me it's very important that I want to share these things with other people because I don't want anyone else to
go through what you
I was powerless. I felt powerless.
Yeah.
And I want to empower people.
Wow, that's life-changing.
It was
what you
life-changing.
experienced. Hi everyone, welcome to Somay Fitness Ask My Physical Therapist segment of our video. And we have a special guest today. This is Heather.
How are you doing?
Heather is passionate about providing personalized one-on-one care, tailoring each treatment to her patients' individual needs and goals. Why did you decide to get into the pelvic floor out of all the specialty?
Great question. So I'm going to share a little bit about myself.
Okay.
So Steve, I grew up in a very small town, a very strictly religious family, and we never talked about sexual function, childbirth, anatomy, even my menstrual cycle was something that, God bless my mother, she just didn't want to share anything about it. I had a baby when I was 19 and I was not prepared. I was not prepared to strengthen my body for the carrying the baby process, for pregnancy and for delivery. And post-delivery I had a tear, an anterior tear in my vagina, and I had a broken tailbone.
Is that episiotomy or is that?
What is it?
Episiotomy, they call it?
Episiotomy? No, they did not do the cut. I had a tear.
Oh, it's a
Yes. And so you have first, second, and third degree tears depending on the depth of them. And so I had a second degree tear into the clitoral region.
Wow.
So this damaged my urethra, and my tailbone was also broken. But no one addressed those things. And so I sat like this because I couldn't get myself down because I hurt.
It's pain,
Very painful. My advice from my good Southern ladies was to put your girdle on and smile.
Oh, man.
Hold your tummy in. My midwife said, it's going to get better, but it never got better. And so I went into my 30s with urinary incontinence, low back pain, sacral pain, ended up with a radicular injury causing nerve pain in my leg. And when I went to grad school in my early 40s, one of my professors said, why don't you go see a pelvic floor PT? And I did. And with some intravaginal work and some education about my body and pressure management, I was able to control my symptoms. I no longer am incontinent. I can control my back pain. And for the first time, I could sit down without kind of popping
lifting
over.
Your hip,
So to me, it's very important that I want to share these things with other people because I don't want anyone else to
go through what you
I was powerless. I felt powerless. And I want to empower people.
Wow, that's life-changing.
It was
life-changing. What you experienced. So from the time you gave birth until the time you figured out what's pelvic floor and therapy, how many years were that?
I was 19 and then I was in 42.
Oh my God, that's a long...
I went to a urologist, and I'm not knocking all urologists, but I went to one who said, well, sweetheart, that's what happens when you have a baby.
Oh no.
Okay, I wore my cycling shorts to the gym in case I peed on myself.
Wow. So, we respect doctors, so they're an authority, so you just basically listened. And
That's the nice thing now. I think pelvic floor has gotten very progressive. In fact, recently I've seen a urologist who said, go see a vulvar specialist, go see a pelvic floor PT. And so pelvic floor PT is out there. It's a resource, whereas it was not previously a resource. This is a growing field and has not been going for that long.
Wow, appreciate you sharing.
Yes, well, thank you. It's important to me
it's
to share.
Personal, but I really believe it will help a lot of our clients and people who are going through experience like that.
Yes.
What are some dysfunction in pelvic floor that you've noticed with your patients?
The primary diagnosis I get, of course, is incontinence, urinary incontinence.
Okay.
And let me just tell you that incontinence is not normal. It is not normal to lose your urine if you're laughing, coughing, sneezing. Male powerlifters report incontinence with lifting heavy weights.
Correct,
So do
correct.
female powerlifters, of course. It's not normal to lose your urine when you're getting to the bathroom or as you're kind of shimmying down your pants. That's not normal. So I see a lot of incontinence. One area of incontinence that's not talked about a lot is post-prostatectomy. And that's after a man has had his prostate removed after prostate cancer. So the prostate actually presses against the urethra to help hold urine. And when that organ is gone, not only are everybody in the pelvic floor is really confused and the brain doesn't know what to tell it, that pressure is gone.
I see.
And so we offer what's called bladder retraining and clamp retraining to help retrain that pelvic floor to hold urine.
I see. Wow. Yeah, especially men, we don't
No, we don't.
kind of hush, we don't talk about those things.
That's right.
Yeah, but I have a male client who underwent prostate surgery, and you know, it's challenging. You know,
It is very challenging. It is very challenging, and it's a dignity tag, and people don't want to talk about it.
Yeah, you don't want to get judged and you know, labeled or.
That's true.
Yeah,
It's true.
Yeah. Okay.
Another area that pelvic floor therapy addresses is constipation and fecal incontinence.
Oh, okay.
Yeah, so we do dietary training. We work on relaxation of the pelvic floor, a relaxation of the rest of the body, breathing techniques to reduce constipation, and also strengthening the pelvic floor to reduce fecal incontinence.
Okay. Just to give the viewers an idea, what's a pelvic floor? Sometimes, like, I remember one of our classes says it looks like a hammock. They said.
Yes.
Can that hammock be too tight or too loose, or?
Yes, it can.
Yeah.
So
What's wrong with too tight?
Well, okay, so we see it's muscles, right?
Yes.
The sliding filament theory of muscles has been the norm,
Yes,
correct?
correct,
That's the
yeah.
actin-myosin bridges where the muscles can slide all the way together or they can come all the way apart.
Yes, yes.
And so when we think of,
Right.
just do your Kegels.
Yeah.
One thing, sometimes people don't actually know how to do a Kegel.
Correct,
And they're
yeah.
squeezing their legs together or their cheeks together and
Yeah.
not lifting the pelvic floor.
Yes.
If we have an over-tight pelvic floor, or we have a pelvic floor that's maybe firing only on one side and not the other, a Kegel is not going to be the answer.
I see.
Sometimes the pelvic floor is taking the brunt for another weak muscle somewhere else.
I see.
So
okay.
here's an interesting case that I had. I had a woman in her late 60s with suddenly occurring incontinence. She'd never been incontinent before,
Yeah.
didn't know what was happening. She came to me and did the exam, and one side of her pelvic floor was very, very tense.
I didn't know that there's two sides.
Yes, yes. So when we
So-
look at it, we have two
Okay.
sides. Yes, and when
that's right. Yeah,
when I
okay.
document on a clock.
So one can be dysfunctional and
One
one
can be dysfunctional.
Ah, interesting. Okay.
So it turns out this person had broken their ankle
Oh.
a year and a half before,
Okay.
and this leg was weak. The pelvic floor had taken over for the weakness and was now pulling on the urethra.
Oh, wow.
So we had to strengthen
Yes.
the
yes,
leg.
yes. Uh-huh.
So there are lots of exercises to
Okay.
strengthen and to address the pelvic floor, and that's why it is so important to go to a practitioner and even to the Pilates studio and to your other orthopedic
Correct,
therapist,
correct.
so you have a whole picture of what's going on with you.
Yes. yes.
So a lot of times a client will come to me and say, oh, I was working with Steve and
Yeah.
he's noticed my adductors are really, really weak.
Yeah.
Or he's noticed my hip rotators are really weak. That's good to know
Yeah.
because now I know maybe
Yes, yes,
what's
yes.
happening with the pelvic floor.
Yeah. They have to understand it here for them to heal as
Yes.
well, right?
Yes.
So,
Oh, yes.
yeah, wow. It's a lot to learn. Like, how would you give an imagery to a male patient? What's a pelvic floor? You know, like men, like
So
what is
use,
that?
I use a pelvis model. I apologize.
Okay.
I didn't bring it today. It was
Yeah,
just
yeah.
so hot. My brain wasn't working.
I have
when
one
I got
here.
In the car.
I'll get
Okay.
one. I'll get it. Well, a quick one. You know, male is patients they're not used to.
Yes.
They know all the muscles, the pecs, the legs,
So
the pelvic floor, not
the pelvic
much.
floor model that I have looks like this. So we
Uh-huh.
have the innominate
Okay.
and the sacrum and the coccyx, but mine also has all the muscles in it.
Oh, I see. Okay.
And so what I do is I just pull off the stuff, and I show them the muscles.
Yes, yes.
And so when I do my initial evaluation, I have my little pelvis model,
Okay.
and I walk through it with the client.
So for
Here
them to
are the
understand.
bones of the pelvis. Here are all the muscles of the pelvis.
Correct.
This is how it works. And that way we can see it.
Yes.
And especially for men, once we remove the external genitalia, pelvic floor muscles are actually quite similar.
Okay.
Yes. And so I saw that you had asked a question about that
Yes.
earlier.
That's in the lens of yoga. This area is the pelvic area.
Yes, so,
what do they? What's their view on the
Mula
pelvic
Bandha
area?
is our pelvic floor. Idiana Bandha is our
Yes.
abdomen.
Yes.
So it's very interesting as
Yes.
far as yoga, and I actually have a workshop, and it's called Pressure Management in the Yoga Belly.
Oh.
For many, many years,
Okay.
I taught my clients to just breathe into their belly, and
Yes.
then breathe out. Well, when I do that, I'm actually putting a lot of pressure on my bladder.
Oh.
I went to some extended learning classes
Okay.
and continuing education, and did breathing mechanics with Herman and Wallace and with a couple other yoga practitioners. And when we look at this breathing, our diaphragm is here.
Correct.
Most of our connections are in the thoracic spine.
Yes.
We do have some that come down to our hip flexors. So we want to really be breathing into
There.
my back
Yeah.
and into my thoracics and
Correct.
out instead
Yeah.
of straight down.
Yes. Yes.
Yes.
That's a different breathing.
It's a different type of
Yeah.
breathing.
I'm excited. In August, I'll be going to New Orleans, the Fascial Congress.
Oh, wonderful.
Fascial Research Congress. So I'm gonna be part of a dissection table. I'm not non-medical, but they allowed me. So I'm excited to
That is-
see all this, how the diaphragm's connected to your psoas and
It's
all the way to the
eye-opening.
tongue. So hopefully I don't pass out. And but I'm excited. The top researchers of fascial research science are all there, like Carla Stecco, and so we're excited about that.
Well, I'm interested to learn,
Yeah.
learn about what you learned there.
Yes, yes. So, Heather, I have a question. Like, how can pelvic floor issues lead to urinary incontinence?
So there are a lot of things that can lead to urinary incontinence. One of them could be weakness of the pelvic floor muscles themselves, so that
Okay.
they're not lifting and providing enough support.
Okay.
Another issue could be prolapse
Yeah,
that's
yeah.
causing the bladder or the uterus to come down. Urinary incontinence could also be caused by poor pressure management of breathing as well. We discussed earlier post-prostatectomy
Yes.
for
correct.
urinary
men.
incontinence as well. So there could be a lot of dysfunction, and also a pelvic floor that is too tense can lead to urinary incontinence.
Will is aging affect
Yes, so there are a couple of things.
incontinence? Yeah.
Aging can affect incontinence. So especially for women, there's genital urinary symptoms of menopause that happen. Because after we lose all that great estrogen, you know, things as our skin gets a little bit crepey and as our legs, it happens to our vagina as well. And it's called vaginal atrophy. And what can happen is the tissues can begin to pull back and the urethra can be affected.
I see.
And that can also lead to incontinence because those tissues don't have the bulk anymore to hold the urethra closed.
Okay.
We do recommend that our clients see an OBGYN or
Okay.
physician and use an estrogen cream for those things. And there's other over-the-counter products that
Okay.
we can recommend as well. Another thing that I can offer for my clients is bladder retraining. A lot of times if we're drinking too much or too little or at the wrong time or the wrong things or eating the wrong things, the bladder can be irritated.
Interesting.
And it can be
Okay.
quivering
Yeah.
all the time
Yeah.
and it doesn't know how to relax and fill and it will lose its urine.
Okay.
So there are lots of
Wow, that's a lot. How can posture impact our pelvic floor, like function?
So posture plays a big role in
Yeah.
pelvic floor. Studies have shown that even tension in my jaw can cause tension in my pelvic floor.
Because there's a like kind of diaphragm here or something, or in our jaw?
Just tension in the jaw is
Really?
related to pelvic floor.
Wow.
Also, you have to think about your spine. So here's the top of your head, and your sacrum is the end.
Yes.
That was the neural tube when you were formed.
Okay.
So if I am slumped forward like this is creating neural tension.
Which most of our practice.
Yeah, I'm not getting the nutrition and the circulation to this area of the pelvic floor.
Okay.
Also, my breathing mechanics will be changed. And so posture does play a really big role in that.
That makes me sit up straighter.
Yeah.
Okay. Wow. That's we're not really meant to sit like this all day, right?
No, we are not meant to sit like this all day. And if I am sitting like this, I can't actively breathe. I'm not able to sit like this, and my pelvic floor is not going to lift correctly.
It's not lined up.
It's not lined up.
Okay.
It's not lined up.
Okay, better line up that pelvic floor there.
Yes. Also, the sacral plexus innervates our pelvic floor, and so the little saying in grad school is S2, S3, S4 keeps poop and pee off the floor. If I'm in a poor posture, then I may be compressing the nerves that innervate my pelvic floor, and I'm not getting full function as well.
Wow, man.
The body's
We're
a
in
system.
trouble.
The body's a system, Steve.
So how can physical therapy help the pelvic floor, especially you're a specialist in the pelvic floor?
Yes. Well, physical therapy in general is great for anyone because a PT is trained to be a functional movement specialist and anatomy specialist. It is really hard for me not to stare at people because I'm like, ooh, what's going on with their knee? The nice thing about having a PT on your side is the PT can see where the movement dysfunction is and help you fix it. With pelvic floor PT, not only does your pelvic floor therapist have the ability to look at you completely, we have the ability to really assess what is going on with those pelvic floor muscles. Like we can offer skilled manual therapy. So those are muscles. We offer soft tissue mobilization to the muscles, electrical stimulation to those muscles. Dry needling can also be offered for pelvic floor.
For pelvic floor.
Yes. So we can go through the sacrum, the sacral plexus, or we can go through the tissues in the labia and below the into the perineum.
Okay.
To treat pelvic floor.
If you have a patient who have a bladder issue, like, would that affect the pelvic floor?
Yes, yes. And so the first thing I would talk to with my patient that has a bladder issue, I would first get a full medical history from them. Like, what is their medical history?
Correct.
Then I would give them a voiding log, and I would have them take it home, and for 3 days have them write down everything they drink, when they drink it, and when they're going to the bathroom. Because what we're drinking and when we're drinking and how we're toileting can affect the pelvic floor.
Really?
Yes.
Okay. So you have to see that timeline.
Yes, you have to see the timeline. Then we would look at strength of the pelvic floor. We would assess for too much tension, too little contraction, maybe a prolapse, maybe poor abdominal strength.
Correct. Yeah.
Yeah, there's a lot to look at.
Okay. So diet can influence pelvic floor, huh?
Diet can definitely influence pelvic floor.
And frequency of drinking water. I never realized that.
Yes.
Or lack thereof.
So I recently took a nutrition class about menopause and diet. So what I've learned, so what I've learned is the high fiber diet that I often push to my clients. So I encourage my clients to get 25 to 30 grams of fiber per day. And that's not in a supplement. That's in good, healthy fruits and vegetables and good fibers. Because what this is going to do, it's going to create solid bulk-forming stool that's going to pass easily.
Correct.
If you have the kind of stool that's passing easily, then you have less chance of getting prolapse and pelvic floor tension and pain in the pelvic floor. Also, a diet that is very high in fiber like this creates prebiotic and probiotic in the gut.
Okay.
So that you don't need to take don't need to take your probiotic supplements, and those are very expensive if you get good ones. Also, a good high fiber diet with this good probiotic in the gut helps absorption of estrogen.
Oh,
yes,
okay,
and so this is going to help the pelvic floor be healthier because we want estrogen to keep the tissues of the pelvic floor very supple
Can you give us some examples of foods that are good for high fiber?
Yes, avocados are a great source of fiber.
I take that every morning.
Yes, raspberries.
Raspberries, okay.
Yes, cups of fruit. We recommend good, healthy, like steamed vegetables. If you don't want to do meat, you can do things like legumes. Jury's out on soy. Some people agree, some people don't. Yes. But definitely lots of fruits and vegetables.
Okay. Can you suggest any resources or support groups that are available for people who have pelvic floor issues? Or?
I always refer people with bladder irritation to the Interstitial Cystitis Foundation website because they have a lot of good dietary resources for things that irritate the bladder and things that calm the bladder.
Okay.
Yes.
Good.
I also refer people to look up sources of fiber. A lot of times I just make a list of things for people and say, what do you like to eat? And then we go through it and we say, okay, here's your sources of fiber. Yeah. Also, if you're having a pelvic floor issue, it's always great to speak to your GI doctor, especially if you're having a chronic pain, constipation, gas that you cannot control. Your urologist is a great resource as well, and your pelvic floor therapist.
Okay. Good. But Heather, thank you so much for
Thank
sharing all your wealth of knowledge.
I appreciate you having me.
If you are looking for a pelvic floor specialist, we have Heather here, available here at Sumay Fitness. So just contact us directly and we'll refer you to Heather to help you out. So again, thank you, Heather.
Thank you. I really appreciate you.
For your time and expertise.
Thank you so much.
See you next time. Bye.